My name is Stephanie Bema. I am a registered nurse in Kalamazoo, and I'm also a board member for the Epilepsy Foundation of Michigan, and I'm happy to be moderating your discussion this afternoon. So the topic for today is navigating health insurance, and we're very pleased to have as our speaker Amy Miilu. Amy is the Health Insurance Resource Specialist for the State of Michigan's Department of Insurance and Financial Services, also known as DIFS. I'm not sure which is easier to say. So Amy, can you briefly introduce yourself and talk a bit about DIFS and the Health Insurance Consumer Assistance Program, please?
Good afternoon. Hi, everyone. Thank you for inviting me to your lunch and share session. Like Stephanie said, my name is Amy Miilu, and I'm the Health Insurance Resource Specialist with the Department of Insurance and Financial Services, which is also known as Dept, and Dept is way easier to say than the whole name. I'm excited to share information with you about the department and provide you with some really important health insurance information. So I just want to warn you that I'm going to be throwing a lot of information at you in this hour. So just maybe grab a piece of paper and a pen, take notes as I'm giving you information, and then jot down any questions that come to mind. I'll be taking questions at the end of the presentation. I run the department's Health Insurance Consumer Assistance Program, otherwise known as HICAP, that offers free help to anyone looking for health insurance or for people who have questions just about health insurance. HICAP provides unbiased, factual information about health insurance and really gives you your options and rights under the law in easy-to-understand terms. The Department of Insurance and Financial Services became a state of Michigan department about 5 years ago. Prior to that, we were known as the Office of Financial and Insurance Regulation and housed under the Department of Licensing and Regulatory Affairs. We have approximately 300 employees, and our office is located in Lansing, Michigan, about a block from the state capitol. And then we have field staff working all over the state, field staff who work from home and visit insurance companies throughout the state of Michigan. Our mission is to provide a business climate that promotes economic growth while ensuring the insurance and financial services industries that we regulate are safe, sound, and entitled to public confidence. DIFS also provides consumer protection, outreach, and education services to Michigan citizens. I've been doing outreach for a little over a year now, and I was really pleased when the Epilepsy Foundation reached out to me because this is my first time doing a telephone presentation, so I've been looking forward to it. So the department regulates insurance companies, insurance agencies, insurance agents. We regulate state-chartered banks and credit unions, and consumer finance entities such as mortgage companies and mortgage brokers, payday loan companies, kind of like those pay, like get cash now type places, debt management companies, and then sales finance entities. Some examples of entities we don't regulate are federally chartered banks or credit unions, and then banks chartered by other states, or we don't regulate securities either. We work to ensure that the companies we regulate are financially solvent, are in operational compliance with all laws, and that Michigan consumers like you are protected. We strive to have a regulatory climate in which the insurance and financial services industries are poised for economic growth and sustainability. So really, why does all that matter? Well, whether you guys realize it or not, Michigan citizens have a lot of money tied up in insurance and financial products. Heaven forbid if your house burned down or you were in an auto accident, we want to make sure that your insurance company has the funds to pay your claim. We want companies to follow the terms of the contract that you purchase with them and that everyone is treated fairly. So just real quick, I want to talk about the Office of Consumer Services within the department, which is the area that I work in. So I think this is the most beneficial area for you guys, because if you were to call the department with an insurance question, we'd be the area that you would talk to first. So when you call our 800 number, it's 877-999-6442, and I'll say that throughout the presentation. Our call center has 7 individuals that answer the phone and serve as the initial point of contact for the department. They're very knowledgeable about the entire department and most likely will be able to answer your questions. If they can't, they'll transfer you to someone who can. Within the Office of Consumer Services, there are 12 insurance analysts who review consumer complaints on a daily basis. We also have several analysts who review the consumer finance and financial complaints. I'll talk more about the complaint process a little later. Just some statistics from last year, we handled over 5,000 complaints, which a majority of those complaints were insurance complaints. And then we recovered over $6 million last year for consumers. Now, this is money going back to consumers. It's not money that's being paid to the insurance company or back to the state. So it's all going into the pockets of consumers. The most common insurance complaints that we get is involving health insurance claim denials and then claim delays.
Fantastic. Well, thank you so much for that wonderful introduction. If you're ready, we'll go ahead and get started with some of our questions. I think to say that health insurance in the United States is complex would probably be a pretty big understatement. So for those living with chronic health conditions like epilepsy, they often require more healthcare services. For those population, navigating this complex system can be quite confusing or frustrating. Could you give us an overview of the different public and private health insurance options that are available to residents of Michigan, including things like eligibility, costs, the coverage plans?
Sure. Okay, so I'll start with individual health insurance. So there's a couple of different ways that you can buy individual health insurance. So I'm not sure if you've heard of the health insurance marketplace, or people refer to it as Obamacare. Obamacare is something that you would purchase through the health insurance marketplace. You can also purchase marketplace insurance through an insurance agent or directly from an insurance company. Insurance can also be purchased outside of the marketplace through a licensed insurance agent or company. And if you want to check the company or the agent that you're working with to make sure that they're licensed, you can go to our website or you can give us a call. Our website is michigan.gov/DIFS, which is DIFS. A couple of benefits of purchasing coverage through the marketplace includes additional cost savings that you can receive if you're eligible, such as a monthly tax credit to lower your premium, or cost-sharing reductions like a lower deductible, lower co-payments, or co-insurance. And I'll talk about the definitions of those terms a little bit later. We also have a spreadsheet on our website that talks about just in general, like approximately what marketplace plans cost for 2018 based on your age, your sex, where you live, and then tobacco status. So those are the only things that individual health plans can be rated on. Now, group insurance is something that you can get through your employer or possibly your spouse's employer. And there's many different plans available through the employer, and the employer would pick the plan, and then that would be the one that you purchase, or maybe they'll offer several different plans, and you can pick and choose what one you're interested in. So if you were to lose group insurance, though, your employer has more than 20 employees, you're eligible to purchase something known as COBRA, which is a continuation coverage, and that's often more expensive than your regular group insurance that you had as an employee because the employer no longer pays their share of the monthly premium. So that's kind of the difference between individual and group insurance. Public options include Medicaid or Michigan's Medicaid expansion, known as the Healthy Michigan Plan. These plans have income eligibility requirements. Eligibility is determined by a different Michigan department. It's the Department of Health and Human Services. So the Department of Insurance does not get involved in eligibility for Medicaid. But they do have a website now that you can visit and do your application online, and it's www.newmibridges.michigan.gov. Or there's a toll-free number to apply for Medicaid, which is 1-800-642-3195. And then I'll just kind of talk about Medicare a little bit. We also don't regulate Medicare. It's regulated by the federal government, Centers for Medicare and Medicaid Services, also known as CMS. Medicare provides health coverage to people who are over the age of 65 those people receiving kidney dialysis treatments and are eligible for Medicare Part B. And then you could also be eligible if you're under 65, disabled, and have been receiving Social Security benefits for 24 months, Social Security disability benefits for 24 months. So just a quick breakdown of Medicare. It has two main parts. Part A is hospital coverage, for which most people are automatically eligible upon turning 65. It has coverage for hospice care, limited skilled nursing care, and then home health care. There is a deductible that you must pay before before Medicare will begin paying for health services. And then there's Part B, which is the other part, which is your medical insurance, and it's optional. If you do purchase Part B, you are responsible to pay the monthly premiums, and they're usually deducted from a person's Social Security check. Medicare under Part B will pay 80% of covered health care costs, and then you would be responsible for paying the remaining 20%. So to cover that 20%, you could purchase a Medicare supplement policy. Medicare, like I said, is regulated by CMS. Excuse me, but Medicare supplement policies are actually regulated by our department. So if you were to have a problem with your Medicare supplement policy, you could give us a call. So just a couple things you should kind of know about Medicare supplement policies. They're often called Medigap policies. So Medigap and Medicare supplement are an interchangeable term. Medicare supplement policy only covers one person. So if you and your spouse both need Medicare supplement, you have to purchase separate policies. You have to pay the monthly premium. And then the plan must provide benefits that are designed to cover your deductible and co-insurance under Medicaid. And these amounts are subject to change automatically to coincide with any changes in Medicare. The policy, finally, the last thing I was going to say about Medicare supplement is the policy is guaranteed renewable and can only be terminated if you fail to pay your premium or if the insurance company can prove that you lied on your insurance application. So that is it for the different options.
All right. So most private insurance plans, and actually in many cases the public options as well, are now managed care plans. What exactly is a managed care, or what does managed care mean, and how does this differ from what was the traditional fee-for-service model? And could you maybe touch on the different features of the most common types of managed care plans?
Absolutely. So, okay, in the past, most individual health plans consisted of the traditional fee-for-service plans, which means the patient could pretty much go to any doctor that they wanted, and there weren't necessarily networks of providers and in and out of network benefits. Medical expenses were received or medical services were received, and then the insurance company would reimburse the patient instead of paying the provider. So we're now making a shift towards that managed care model. Managed care can be seen in group health plans and now is seen in a lot of individual health plans. So some examples of managed care plans include a health maintenance organization, or HMO. This type of health plan limits coverage to their network of providers. It generally won't cover out-of-network care except in an emergency. An HMO may require you to live or work in its service area to be eligible for coverage. And then all care is coordinated through the member's primary care physician, also known as a PCP. And so you must pick or designate a PCP when you sign up for the plan. There's also an HMO point of service plan. This type of HMO plan does have in-network and out-of-network benefits. But usually when you receive out-of-network benefits, there's going to be higher out-of-pocket costs for you. So that's just something to know. There is a preferred provider organization, or a PPO. This is actually not a specific type of health plan, but it's a contract between an insurance company and then a network of providers who agree to provide health services at an agreed-upon rate. So I know that Cofinity is talked about a lot, and that would be an example of a PPO. PPOs are less restrictive than HMOs, that they don't require a referral to see other providers within the network, and they do typically have out-of-network benefits, but again, your financial responsibility will be higher. So just to avoid higher out-of-network costs, it's important to check with your insurance company to make sure that the provider you want to see is in the insurance company's network. And if it's not, you should really understand what your cost is going to be to see that out-of-network provider. Finally, I just wanted to touch on a preferred provider arrangement, which is an optional feature of a health plan, and it includes, again, a network of participating providers available to the member to obtain cost-effective medical services.
Okay. You mentioned briefly out-of-pocket costs and making sure you have a good understanding of that. I think that with health insurance, there's a lot of sometimes confusing costs, trying to understand the difference between what your deductible is versus your coinsurance versus your copay. So could you maybe help us understand those variables a little bit more and how maybe they could influence the decision that you make about which plan you want to choose?
So, yeah, there are so many different health insurance terms, and sometimes it can be confusing to try to figure out what it means and if, the copayment applies to the service or coinsurance and how and when it applies. So the department actually created a glossary of important health insurance terms, and it's on our website. If you were to go to michigan.gov/HICAP, and then click on interested in more health insurance information, there's tons of health insurance information out there, and there's a glossary. So I'm just going to talk about a few of the important terms that you should know. So first and foremost, your premium, that's the amount of money you pay to keep your health insurance active, right? That should be the most important one to know, because without paying your premiums, you won't have a health insurance policy. Premiums are usually paid monthly to your insurance company if you have an individual plan. If you're insured under an employer group coverage, premiums are mainly deducted from your paycheck, and then the employer would make those premium payments directly to the insurance company. Now, a deductible is a specific dollar amount of covered medical expenses that you as the insured person must pay before your health plan will pay. So now let me give you an example. It's normally an annual amount. Let's just say, for example, your deductible is $5,000. Your plan won't pay for your health care services until you've paid $5,000 out of pocket. Now, there's a thing called a family deductible plan or a per-person deductible plan. Under a family deductible means that all of the family's claims have to equal $5,000. While a per-person deductible would mean that each person within the family has to pay $5,000. So hopefully that makes sense. If there was a 3-person family and you had that per-person deductible, that deductible would be $15,000. So another term that's important to know is coinsurance. It's the percentage of covered expenses you are responsible for after your deductible has been satisfied. So, for example, after you've paid that $5,000 deductible out of pocket, you're going to pay 30% of your covered health care claims. Now, this percentage could be different for different services, so you would just want to know what your coinsurance is, and if your plan even has coinsurance, because not all of them do. Copayment, also known as a copay, is a fixed dollar amount paid to a provider at the time health care services are received. So an example of this would be I have a cold and I need to go see my primary care physician, so I would pay him $20 for that office visit. And then finally, just the out-of-pocket maximum is the most you'll ever pay during a plan year. So if your plan starts January 1st, so from January 1st to December 31st, the out-of-pocket maximum is the most that you'll spend for that year. So the example that I came up with is your $5,000 deductible has been satisfied. You go ahead and pay your 30% coinsurance until you've reached your plan's, let's say, $8,000 out-of-pocket maximum. So $8,000 would be the most that you would pay. And this is just hypothetically speaking, every plan's different.
One of the terms that we often hear regarding coverage related to the Medicare Part D is the donut hole. What exactly is that?
Okay. Medicare prescription drug plans are also known as Part D plans. Like you said, have a coverage gap known as the donut hole. So what this means is that after you and your Medicare Part D plan have spent a certain amount of money, you have to pay the out-of-pocket costs for your prescriptions up to a certain limit. So if you reach that donut hole, you would, again, have to pay out of pocket, but you get a discount on covered brand name prescription drugs. The discounts and the limits that you have to pay before reaching the donut hole all change annually. So Medicare.gov is really the best place to go to make sure that you know what those limits are.
Fantastic. So earlier, you did mention Obamacare, which is officially known as the Affordable Care Act, and that's really made a number of significant changes to our healthcare insurance system. Could you maybe go over the key elements of the ACA, how it's maybe changed over time, and just basically how it benefits or affects us as consumers?
Yeah, I just tried to pick a few of the important provisions that I thought you guys should know about. So the Affordable Care Act, which I'm going to call it the ACA, was signed into law in 2010, and it definitely provided significant changes to how we purchase health insurance, how we receive care, and then the following is just a few examples. So the individual mandate provision of the ACA requires people to obtain health insurance or pay a federal tax penalty. So if you have insurance, then I'm sure that you're aware of this tax penalty. The tax penalty is going to be enforced for all of 2018, but then in 2019, the tax penalty is going to be zero. So you're no longer going to be financially penalized for not having health insurance. And that's, again, beginning January 1st, 2019. So an insurance company can no longer deny you insurance coverage if you have pre-existing conditions. Health plans are now required to offer you free preventative services. Insurance companies can't charge you a deductible, co-payment, or a co-insurance for these types of preventative care if it's received by an in-network provider. That's an important part of it. Some examples of the preventative care are flu shots, other immunizations, mammograms, and other cancer screenings, diabetes screenings. There's a more comprehensive list of these free preventative services that you can take a look at healthcare.gov. Some other important provisions the ACA created are insurance companies are prohibited from retroactively canceling your health plan unless you fail to pay your premium, you commit fraud, or you make an intentional misrepresentation of an important fact on your insurance application. So pretty much if you lie about something on your application, they may have grounds to cancel your policy. But if something like that happened, you should definitely give us a call and we can look into it to make sure that they have followed the law. So there's no longer lifetime or annual dollar limits on your health care services. And then this is a pretty important one. Your dependents are now allowed to stay on your health plan until age 26, even in the following instances. Even if they can get coverage from their own job, even if it doesn't matter if they're a student or not, so the student status doesn't matter anymore. Whether or not they're financially dependent on their parents or if they're claimed as a tax dependent, they don't have to live in your home. They can be married and still stay on your policy, and then they may also have had a child or adopted a child. Just a couple other things I wanted to touch on. All individual and small group health plans are required to offer 10 essential health benefits. So these have to be included in your plan. Ambulatory patient services, emergency services, hospitalization, maternity and newborn care has to be covered. This is a big one. Mental health and substance use disorder services, including behavioral health treatment, has to be covered. Prescription drugs, rehabilitative and habilitative services and devices, lab services, preventative and wellness services, and chronic disease management. Finally, pediatric services, including oral and vision care. So these have to be covered in order for a health plan to become certified and offered on the marketplace. as well as Medicaid plans in Michigan must also cover these services. Okay, so the last provision that I wanted to talk about is just the Mental Health Parity Act. It's the Mental Health Parity and Addiction Equity Act of 2008, otherwise known as MAPIA. It's a pretty complicated law, but the biggest thing that I wanted you guys to know that individual and small group plans now have to provide mental health and substance use disorder benefits as those essential health benefits that I just briefly talked about. So pretty much any plan that offers mental health and substance use disorder benefits have to provide the benefits in a comparable way to how they apply medical and surgical benefits. So if someone felt like there were too strict of requirements to receive mental health services, they should most definitely give our department a call and we can look into their plan and policy on their behalf. So that is all on the ACA, which I know is a lot. So.
It's good, though. It's real good. So it sounds like, I mean, it's good to know that all plans have to give those same benefits. And fortunately, many, many people have the option of choosing which plan they're interested in. So if everything has to be covered, clearly there still must be some differences, and so that can be a confusing decision to make, which plan to go with. So what are some of those key questions maybe that people, especially people with chronic health conditions like epilepsy, should ask when they're looking around or they're trying to determine which type of health insurance they should go with or which plan?
Sure. So how much is it going to cost, right? That's pretty important for anyone. So what's the cost of the monthly premium is something you should ask. What's the annual deductible? Is it that per person deductible, or is it the combined family deductible that I talked about a little earlier? Are there benefits you can access without first satisfying that deductible? So an example of this is that your house plan may offer you 2 office visits that can be used without meeting your deductible first. Know what health services are excluded. So an excluded service means one that's not going to be covered by your insurance company, and therefore you would be financially responsible for those services that are not covered by your health plan. These non-covered services are listed in the exclusion section of your health policy, and it's usually found in the back of that document. Another question to ask is, does the plan cover prescription drugs? And are your prescriptions on the list of covered drugs? That list of covered drugs is a formulary, and I talk about that a little bit more in a moment. And then also, how much are you going to owe for your medication? So it's always good to have a list when you're shopping of your medications to see if it's something that would be covered and if you can afford it. Are there separate deductibles for healthcare services and then for prescription drugs? Are there tiers or pricing levels for your prescription drug coverage? Another big one is, can you keep your current providers? Again, I always suggest people make a list of providers and take your time doing this because you may forget that one doctor that you see once a year or once every other year. If you can't keep your current providers, does the insurance company have a list of in-network providers that accepts new patients? Does the plan require a referral to see a specialist? And again, that referral usually comes from your primary care physician, or can you just go see whoever anytime you want within the network? Does the health plan require prior authorization for certain services? That's an important one as well. And then, of course, does the health plan provide out-of-network coverage? If you choose to go with an out-of-network provider, how much is that going to cost you? And is the insurance company going to pay anything for it? So those are just a few of the things you could think about when you're shopping for coverage or thinking about switching.
Well, it sounds like there's a lot actually to consider and to keep in mind and remember. Mm-hmm. So when the time actually comes, are there any people like you, let's say, out there, or resources that we can go to get assistance with this?
So if you want to purchase an individual plan for you and your family through the health insurance marketplace, there are individuals and organizations available to assist you. There are navigators and certified application counselors actually in your community that are available to sit down with you to help you complete that application. They can go over your options with you and help you make a decision. And I believe that the website for those, to find those people in your area is, I'm just going to look it up real quick to make sure I'm giving it to you right. I think it's localhealth.healthcare.gov, and then all you have to do is just put in your zip code or your city, and then it'll give you a huge list of people who can help you apply for a Marketplace plan. You can also call the Marketplace call center, and they can take your application over the phone or answer questions that you have. And then finally, you can always work with a licensed insurance agent and insurance company. They can sell you plans through the Marketplace, but they have to go through training and be registered with the Marketplace in order to sell a Marketplace plan. So that's just something to know. And then if you want to purchase health insurance outside of the Marketplace, then you can go through a licensed insurance agent or a authorized insurance company.
Fantastic. Well, it's very reassuring to know that those resources are out there when the time comes, and I think that time is what's referred to as the open enrollment period. So could you maybe just explain a little bit about what that is and why there actually has to be a specific time frame to become enrolled? And, what do I do if I miss that open enrollment time?
So the open enrollment period is annually. Last year and the last couple of years, it was November 1st to December 15th. And when you purchase insurance during that time, your coverage will begin January 1st of the following year. Coverage is only available for purchase during this time because of that individual mandate that I talked about to have insurance. The idea behind the Affordable Care Act is that everybody would sign up during that open enrollment period and be insured for the whole entire next year. So if you do miss the open enrollment period, you have to to purchase insurance outside of open enrollment. You'd have to be eligible for what we call a special enrollment period or an SEP. And here are some of the events that may qualify you for an SEP: losing group health insurance, losing Medicaid. If you move outside of your insurance company's service area, you may get an SEP. Getting married, getting divorced or legally separated, and then having a baby or adopting a child. These are not the only qualifying events. There are lots of other events. I just tried to pick the simplest ones to explain. But if you think that your situation may qualify you for an SEP, I would suggest that you go to healthcare.gov or call the Marketplace to complete an application, and then also an insurance company or an insurance agent would be able to assist you as well.
Okay. You did mention earlier that when shopping around for a plan or comparing plans, knowledge of the prescription coverage is an important thing to keep in mind. And definitely for persons with epilepsy, I'd say that prescription drug coverage is probably one of the most important elements when they're looking for an insurance plan. So could you help us understand a little bit more about medication formularies and the different tiers and how you would figure out how your plan that you're looking at would approach generics versus brand name medications?
So a formulary is the insurance company's list of covered prescription drugs. It's typically set up by tiers, with each tier representing a different price point for medications. Typically, when you're shopping for coverage, you can get a copy of the formulary and see where your medications fall on that list. So tier 1 is generally going to be your generic medications, and it's going to be your lowest copayment. As tiers get higher, so does your financial responsibility. When you're shopping for a health plan, you should look to see what tier your medications are in and how much they'll cost you. Of course, it is possible for medications to change tiers or no longer be covered when a new plan year starts. Therefore, when you're shopping for coverage, it's important to, 1, shop around and review your coverage options during open enrollment. You should continue to take a look at that formulary during open enrollment to see if it changed. Don't always assume that just because it used to be covered that it's still going to be covered and at the same price, because it is to change. Same goes for providers. So if you're thinking of changing to a new provider, check to see that they're in your health plan's network. I've kind of been saying this a lot, but choosing an in-network provider means a lower cost to you. If you want to see an out-of-network provider, you have to check and see before you visit that provider if your plan offers out-of-network benefits. Those out-of-network benefits are going to cost you more. But again, like I said, some plans like HMOs don't even offer out-of-network benefits, and you'd be responsible for the full cost. So it's really important that you know and understand these things. Providers can go from being in-network to out-of-network really at any time during the year. So the insurance company's website would be the most up-to-date place to find their current provider network. So if you have concerns, you can review their website or call their customer service department. Typically, that customer service number is on the back of your insurance card. It's just important to keep track of who you talk to when you call, and then kind of maybe just give like a brief summary of what was discussed. In case there's any type of discrepancy later, you are definitely your best advocate when it comes to these types of issues.
So it sounds like really just staying in good contact with your plan and doing good research and not just assuming things won't change is the best way to combat the unpredictability of those potential formulary changes or the need to change a provider, just to kind of keep close eye on the plan.
Absolutely.
Fantastic. Well, we do know, I'm sure everyone at some point has had an experience where they were told that a procedure or a medication that they thought would be covered actually isn't covered, or at least not as fully as they thought that it would be. Are there any specific steps that individuals can take if they need to place an appeal to their insurance company or try and override something that's been denied?
Yeah, so if you disagree with the way your health care claim was processed by your health insurance company, you have the right to appeal that decision. The appeal process isn't just for a claim denial. It's really for any dispute that you may have regarding your claim. You must notify your health insurance company in writing that you want to appeal their decision. There are time frames you're required to meet to file that appeal, and those are outlined in the decision the insurance company sent you. If you're just kind of unsure, you can give them a call, and they should be able to give you those time frames. Once you file an appeal, the health insurance company is required to review your request through their internal grievance process. That's kind of the fancy word for it, but it's really just their internal appeal process. So if they do get your appeal, they have 30 calendar days to review your claim if it's a pre-service claim. So like a prior authorization for a healthcare service, and then 60 calendar days for a post-service claim, and that would be for like a claim denial. There are like expedited review times that you can go through if the claim that's been denied could seriously jeopardize somebody's life or their ability to regain maximum function. And that would require a doctor's certification to, confirm that that's really the case and that it should be reviewed within 72 hours. So if you do go through the appeals process and you still disagree with the decision that your insurance company made, you have the right to file an external review with the Department of Insurance and Financial Services. You have 127 days to file that external review. To do that, you or your authorized representative must complete the healthcare request for external review form. The insurance company is required to send you a copy of this form with the notice of your appeal decision, or you can also get one from our website, and you can actually file the external review online as well. So our website for complaints is michigan.gov/DIF complaints. And then complaints is plural. Yeah, so that's kind of, in a nutshell, the appeals process.
Great. So in some cases, it feels like the insurance provider has a great amount of influence over the specific kinds of treatments or testing that consumers have. Can you share with us what you think are some of the most common practices by those providers that do limit access to what the physician specifically asks for or their physician-directed care? And what can consumers do to avoid those types of things or maybe fight back against those practices?
Sure. So it's hard to say what the most common practice is, but consumers should really be aware of what their rights are under their policy, under the appeals process. And I'm hoping after this presentation that you feel empowered to ask more questions or to give our office a call. If something doesn't feel right, then you have the right to ask more questions and gain knowledge about the situation. So in addition to the external review process that I briefly talked about, we do also have a complaint process where consumers can file a complaint against their insurance company or their agent. If we need to get your complaint in writing, you can go to that website that I just gave out to file an online complaint. Once we receive your complaint, we'll send it to the insurance company or the agent, whoever's involved, get an answer to the issues that you're experiencing, review the issue in its entirety to make sure the company is in compliance with Michigan law and your insurance contract. You'll receive a copy of all the documentation that Dept receives from the insurance company. And like I just said, if something doesn't sound right or if you have questions that can't be answered by your insurance company, give us a call. Our toll-free number is 877-999-6442. If we can't answer your question, we'll advise you to file a complaint so we can contact the company and get the answer for you in writing.
Great. Despite the fact that there are so many options out there, so many plans available, there are still some people who do find themselves without any health insurance sometimes for a period of time. So if that happens, are there options out there or resources for getting access to health care services or prescription medications without coverage?
So if you find yourself without health insurance mid-year and don't qualify for that special enrollment period that I talked about, there's a couple things you can do. Check with your local health department to see if they offer free or reduced health care services. Every county in Michigan has a health department. Additionally, some Michigan counties offer health plans to its residents. The Department of Health and Human Services actually has information relating to county health plans on their website, and that website address is michigan.gov/DHHS. For prescription drug assistance, we usually suggest people contact the drugs manufacturer to see if they offer samples. There also is a Michigan RX card that offers prescription drug discounts. Now, this is not insurance. It's a drug discount card that can be looked up and information obtained at michiganrxcard.com. And then finally, there are federally qualified health centers throughout Michigan that provide primary care services in underserved areas on a sliding fee scale. The website to find a qualified health center near you is findahealthcenter.hrsa.gov.
Those all sound like really great opportunities and resources if that need should arrive. Thank you very much. One last question regarding the elderly population, and as we start to age, we start to think about needing to pay for long-term care, and perhaps curious what the role of Medicaid would be in those long-term care insurances, and how it would be able to help us with paying for the high cost of nursing homes or assisted living facilities.
So if you find yourself in a position where you need long-term care, whether it's in a nursing home, assisted living facility, or if you need home health care, it's expensive. The following are just some of the ways that you could be financially prepared. So, you could obviously pay out of pocket for the care. For most people, though, this may be unaffordable. The long-term care consumer estimated that in 2016, those are the most up-to-date numbers, the annual cost of care in a nursing home was over $103,000 a year. For an assisted living facility, it was approximately $44,600 for the year, and then home health care was over $47,000. So as you can see, that would be very expensive. Depending on what your finances are, you could obviously pay out of pocket for that if it was something that you were fortunate enough to afford. You could also purchase a long-term care policy through an insurance company. Typically, people purchase long-term care policies when they're young and healthy, and the premiums are low because of their age and they're healthy. Because if you wait until you're sick and actually need those long-term care services, you may not even be eligible to purchase the policy. You may not be eligible, or it may be way too expensive for you to afford. Long-term care policies are designed to cover your long-term care costs up to daily limits. Now, there is long-term care coverage under Medicaid, but you would be required to spend down your assets prior to becoming eligible for Medicaid. There is a way to avoid, though, spending down those assets to become eligible for Medicaid, and that's if you purchase a long-term care partnership policy, which is a long-term care insurance policy that may protect a person's assets through asset disregard under Michigan's Medicaid program. So the department actually has a list of long-term care companies that sell long-term care insurance in Michigan are part of the partnership program, so they do offer that asset disregard. So you still could be qualified for Medicaid without spending all your money. Again, this feature allows individuals to protect assets from Michigan's spend-down requirements for the purpose of determining Medicaid eligibility.
Well, Amy, I know that I have learned a great deal already this afternoon. Thank you. Before we open it up for questions from our listeners, are there any additional resources or anything that we haven't already touched on that you think would be important for us to know?
Yeah, so I know I've given you a lot of information today, but our website has a lot of consumer-friendly information regarding health insurance, but also regarding the other types of insurance and consumer finance entities that we regulate. So I would suggest that you go to our website, again, michigan.gov/DIFS, and take a look. If you click on consumers and then publications, there's a huge list of publications that we've created that really breaks down insurance in easy to understand terms. So if you have any questions while looking at that, you can definitely give us a call. And I just wanted to thank you guys all for spending your lunch hour with me and hoping that you learned a little bit about health insurance.
Do we have any questions from our listeners for Amy?
I was wondering something. I have Medicare, Medicaid, and Blue Cross Blue Shield. Now, are there any changes in this? And if so, what changes? What should I do?
Just changes. Do you have a Medicare supplement policy with Blue Cross?
What's that?
The policy.
I do have Medicare supplement.
Yeah. I'm not aware of any changes, overall changes that are occurring this year. Just make sure that when you get any mail from them, that you're opening it and reading it, and if you have questions, that you give them a call.
Okay, thank you.
You're welcome.
I have a question.
Hi.
Hi. I've had a condition for 17 years that I haven't found a doctor to treat it yet, except Mayo Clinic, Kentucky, and maybe Cleveland Clinic. The problem is, when I call these places, they only take Medicare, and I have Medicaid.
Okay.
And so now I guess like Cleveland Clinic maybe accepts the Medicaid, but they're out of state, so my insurance, I want to get there, so my family doctor put a referral in, but they denied it. I went through a grievance, and there was not enough information, wrong code number, all this stuff. So I'm still not getting where I need to be. And this is very disabling because it makes you go paralyzed, weak. It's very, very affects my life a lot. I have weakness, paralyzation with it, all kinds of stuff. So I really, really need to get to this doctor, and I don't know how to do it.
Who do you have your Medicaid with? Do you have an HMO?
No, I'm on SSI.
Okay.
So I think it's straight Medicaid.
Yeah. Unfortunately, we don't get involved in Medicaid and straight Medicaid issues, but they should have Medicaid does have an appeal process that you could go through. Now, if you had Medicaid with an HMO, we regulate the HMOs, and so we would be able to take a complaint for that. But I know, I'm sorry, you could check your caseworker, though, and see, you know, if you've exhausted all those appeal levels with Medicaid.
Yeah, I mean, we did an appeal and a grievance, and they just said there was not enough information. They wrote it in wrong, code numbers wrong, everything. I don't know.
Maybe talk to the provider again to see if there's something that they can add or provide additional information to satisfy that requirement.
Okay. All right.
Are there any other questions out there?
Yes,
Okay.
I got one.
Please.
What's your phone number again, slowly, please?
Sure. The toll-free number to reach the department is 877-999-6442. Yep, 6442.
42. Okay, thank you.
You're welcome.
Was that 877-999-6442?
Correct.
Okay, good, thanks.
You're welcome.
We still have lots of time if there are questions.
Well, I got another one. I got the government where they send these RX cards for drug programs, but they say that they don't cover Medicare, and I got Medicare.
Okay.
Is there a drug program out there that they send you like they do now, I guess, that covers Medicare?
Have you seen if you're eligible for a Part D prescription drug plan?
I am in Part D, yeah.
Okay. But you're looking for assistance in addition to that?
Yeah.
Okay. The only discount card that I'm familiar with is the Michigan RX card. So I'm not sure if that's the one that you're referring to or not. But the Attorney General Consumer Protection,
Who are you? Come here.
They regulate discount cards, and so you may be able to contact them and see if they have any other suggestions for you.
Okay.
And I don't have their number right off the top of my head. Let me see if I can look it up on the internet real quick.
Thank you.
You're welcome. If there's any other questions I can take while I'm looking this up. Okay, it looks like hold on. Michigan Attorney General Consumer Protection Division is 877 765 8388.
8388. Thank you.
You're welcome.
Any more questions for Amy about insurance coverages or plans?
Yes. You said that the insurance is the eligibility is for anyone that doesn't have the insurance, right? You know, like bomb insurance or anything like that.
What you would do if you don't have health insurance? Is that what you're asking?
Yes.
Yeah, so I kind of talked about, let me get back to that. Hold on just a second. There's county health plans, so you could contact the county that you live in to see if they have, if they offer a health plan to the county residents. There's also, you could also contact your local health department to see if they offer free or reduced services. And then finally, there's federally qualified health centers. And you could go to findahealthcenter.hrsa.gov to see what ones are available in your area.
Okay, thank you.
You're welcome.
Are there any other prescription-specific questions? I know that there's been a lot of changes recently with epilepsy medications and access. Any concerns out there regarding that?
Do you think there's going to be any changes in epilepsy prescriptions of medicine as far as the cost is concerned? Because one of the medicines I take is super expensive if the insurance doesn't cover it.
Yes.
I am not familiar with any changes that are coming on the insurance end.
Oh, good, thanks.
Sorry.
A lot of times those medications are more expensive if they're brand named versus generic, if they're how recently they've been released, and so sometimes the insurance doesn't really make a difference necessarily if it's a newer medicine or whatnot.
Okay, good, because some I've been taking for years, and the insurance has covered it for one of them. It wasn't covering it for a while, and boy, it was expensive. And now it does cover it, thank God.
Yep. And probably those formulary changes that Amy spoke of, right, Amy? That sometimes changes with the formulary.
Yeah, definitely. Yeah, so you want to check it.
Cover it. Pardon?
I'm glad it's back to covering it for you, for sure.
Oh, me too. Thank you.
Now, with like your prescription medication, now a lot of them, some of them you just cannot get in generic form, right?
Wait a minute. I'm on the consult. You welcome.
Possibly, yeah. Not all brand name medications have generic alternatives.
Okay.
Okay, because I know, like the young lady was saying, it is, there are
I'm on a business call on the phone.
There are some prescription medication out there that, like your insurance, a couple of the medication I get, majority of mine are generic, but it's a specific one. It's one that is not in a generic form.
Okay.
Where they, how you go about, will they ever be, or, is there a way for, a person can check, or, will they ever be released on a generic form?
That would,
I'm sorry.
I was just going to say, that would be more of a question for your doctor if there's a generic alternative. There's pretty strict requirements for brand name drug to become a generic, and I'm not too versed in that process.
Okay.
But you could check with your provider first.
Okay, check with the, with
the doctor. Yeah.
Because really how I found out a couple of my medication was through the pharmacist. But if the doctor happened to write up a brand name, then that's the way they have to fill it.
Right. If it's, dispense is written, then you would have to get that brand name medication. So again, that would be something you'd want to discuss with your doctor.
Okay.
Well, these have been some very wonderful questions. Thank you again to everyone for listening, and Amy for giving us all this great information. All right, well, thank you so much. Everyone have a wonderful day, and please be sure to check out the next Learn and Share call for September.